Alright, folks, buckle up for a wild ride at Datdangdoctor's channel. Here's the deal, you're over 70, feeling spry, but your doc keeps pushing tests that make you wonder if they're trying to stress you out more than a cat in a room full of rocking chairs. Today, we're spilling the tea on 5 health checkups you might want to dodge after 70, because they could do more harm than a bad karaoke night. Let's dive in and save you from some medical madness. Look, hitting your 70s is like joining the VIP club of life. Less hair, more wisdom, but also more doctors trying to poke and prod you like you're a science project. Some tests that work for the young'uns can lead to false alarms, unnecessary procedures, or side effects that'll have you regretting you ever left the couch. The trick? Chat with your doc to make sure the risks don't outweigh the benefits, especially if you're dealing with chronic conditions or just trying to enjoy your golden years. Let's break down the 5 checkups you might want to yeet out of your schedule. First up, PSA testing for prostate cancer. This blood test checks prostate-specific antigen levels, but after 70, it's about as useful as a screen door on a submarine. Prostate cancer in older guys grows slower than a sloth on vacation, and treatments like surgery or radiation can leave you with side effects like incontinence or, bedroom troubles, with barely any survival perk. The U.S. Preventive Services Task Force says skip routine PSA tests unless you've got a family history wilder than a soap opera or actual symptoms. Ask your doc if it's worth the hassle. Next, routine colonoscopies. These are great for catching colorectal cancer early, but after 75, the risks, like your insides getting poked worse than a piñata or sedation turning you into a loopy mess, can outweigh the benefits if you're healthy with no symptoms. Guidelines say after 75, only bother if you've got a history of polyps or other red flags. Otherwise, go for less invasive options like stool tests, and save your energy for something truly worthwhile, like mastering the art of passive-aggressive compliments or finally settling the debate over whether raisins belong in dessert. Third, mammograms for breast cancer. For ladies over 75, routine mammograms can be like signing up for unnecessary drama. Breast cancer in older women often moves slower than a turtle in molasses, and treatments like surgery or chemo can hit harder than a Monday morning. Experts can't even agree on these after 75, so it's a pick-your-own-adventure deal. If you're fit as a fiddle with years to go, maybe keep him, but talk to your doc to avoid procedures that feel like a wild goose chase. Fourth, routine cardiac stress tests. These check for heart issues but can throw false positives faster than a tabloid headline, leading to invasive stuff like angiograms that might leave you with bleeding or kidney woes. Unless you're huffing and puffing with chest pain or shortness of breath, skip these after 70. Focus on eating your greens, walking the dog, and keeping your blood pressure chill. Your heart will thank you without the treadmill torture. Finally, routine pap smears for cervical cancer. Ladies, if you're over 65 with a streak of normal pap tests, you can wave goodbye to these as cervical cancer risk drops lower than your grandkid's skinny jeans. Unneeded pap smears just bring discomfort or pointless follow-ups. If you've had funky results or a hysterectomy for cancer, check with your doc, but otherwise, save your energy for bingo night. Always make these calls with your doctor, folks. That's the scoop, you legends. These 5 tests, PSA, colonoscopies, mammograms, stress tests, and pap smears, might be more trouble than they're worth after 70. Chat with your doc to keep your health game strong without the extra chaos. Smash that like button, subscribe to Datdangdoctor's channel for more health hot takes, and drop a comment. Tell us the wildest doctor visit you've ever had. Stay sassy, stay healthy,